Let's reading medical papers. The title of this article is Remote Ischemic Preconditioning, Translating Cardiovascular Benefits to Humans. Hello everyone. Today I want to share with you a new method being studied in the medical field called remote ischemic conditioning, or RIC for short. It's a simple, non-invasive technique that may help the heart and blood vessels resist damage and even slow down the progression of cardiovascular diseases. Although it sounds technical, the concept is easy to understand. Let's break it down step by step. Why is RIC needed? Cardiovascular diseases are the leading cause of death worldwide, with about 70% of fatalities related to heart disease and stroke. When blood vessels become blocked, causing ischemia, lack of blood flow, in the heart or brain, restoring blood flow can sometimes cause reperfusion injury, which worsens tissue damage. Medical researchers have been looking for ways to make the heart and blood vessels more resilient during ischemic events. This is where RIC comes in. What is RIC? The procedure is straightforward. A blood pressure cuff is placed on the arm and inflated to a pressure higher than the systolic blood pressure, temporarily stopping blood flow, then released. Although this causes only localized ischemia, the body activates protective mechanisms that also safeguard distant organs like the heart and brain. You can think of it as warming up the body so it's better prepared to handle a major challenge without injury. How does RIC provide protection? When blood flow is temporarily blocked and then restored, the body releases protective signals. These signals work through neural pathways. Autonomic and sensory nerves transmit signals to the heart and brain. Humoral pathways, substances in the blood, such as nitric oxide, adenosine, and antioxidants, help dilate blood vessels and reduce inflammation. Immune pathways, they decrease inflammatory responses and protect cells. As a result, the heart and blood vessels become less vulnerable to injury during ischemia and recover more quickly. The protection window of RIC. Research has shown that the protective effects of RIPC occur in two phases. The first phase appears immediately after RIPC and lasts about 2 to 3 hours. The second phase emerges later, peaking around 24 to 48 hours after RIC and can last for 2 to 3 days. This means that RIC not only provides immediate protection, but also offers benefits for several days afterward. Animal studies versus human studies. In animal experiments, the effects of RIC are very clear. It reduces the size of heart attacks and protects the heart and blood vessels. However, results from human clinical trials are more inconsistent. Some studies show that RIC is effective in reducing damage after heart surgery, while larger studies have found less obvious benefits. Possible reasons for this include age. Older individuals tend to experience less benefit. Medications. Anesthetics like propofol can negate RIC's protective effects. Health conditions. Diseases such as diabetes and heart failure may weaken the effect. Exercise habits. People who exercise regularly might respond differently to RIC. Single versus repeated RIC. A single RIC session can temporarily improve vascular function and reduce ischemic injury. Repeated RIC over several days produces better results, enhancing vascular health and potentially slowing the progression of cardiovascular diseases. This suggests that RIPC is not only useful as an emergency intervention, but may also serve as a long-term health maintenance strategy. Comparison between RIC and exercise. Exercise itself causes brief periods of ischemia followed by recovery in blood vessels, making its effects somewhat similar to RIC. For individuals unable to exercise, such as stroke or heart disease patients, RIC could act as an alternative that mimics the benefits of exercise. This gives RIC significant potential in rehabilitation and health preservation. Summary: RIC is a simple, low-cost, and non-invasive method. It helps the heart and blood vessels resist ischemic injury and may delay the progression of cardiovascular diseases. Although results from human clinical trials have been inconsistent, research indicates that RIC has the potential to become an auxiliary treatment or a health maintenance approach in the future. Therefore, RIC can be seen as a protective shield for the body. It does not replace conventional treatments, but supports the heart and blood vessels in becoming more resilient. In the future, RIC may become an important part of cardiovascular health care. Do people truly believe that healthy medicine and RIC can promote wellness? Hurry and purchase a healthy RIC sphygmomanometer to enhance your health every day. Don't forget to scan the QR code. Thank you all for watching. I am Dr. Andrew Shu Lee. Until next time.